Well, for those who have been diagnosed with lung cancer, the big question is, what should you do now? What should you ask, and how can you find the newest treatment options that are out there? Our GDL reporter, Elle Bottom, spoke with 2 lung cancer survivors to find out some of those important answers.
Lung cancer is the leading cause of death among Black Americans. While there are still many new treatments, there are disparities across racial and ethnic lines. It is so important to be educated on what to ask, where to go, and find out about new treatment options. With knowledge, there is hope. Joining me today are 2 lung cancer survivors, Brandy Bryant and Dr. Sydney Barnett. Both will share a little bit on their stories and how important biomarkers are. Dr. Burnett, tell us about your story and what's your message about lung cancer research, especially for Black Americans?
Well, when I started my internal medicine residency, I realized that my exercise tolerance was decreasing. I am normally very active. I dance, swim, run track. And I realized that I was just getting short of breath, and then I started wheezing. I have a strong family history of asthma, so I went to my pulmonologist thinking that that was the situation. And after a whirlwind of tests, actually came out with a stage 4 lung cancer diagnosis instead, which just completely knocked the wind out of me. Thankfully, I had a biomarker, and I was started on targeted therapy, and because of that, I have been no evidence of disease for the past 5 years, and that just shows how important research is, because had I gotten diagnosed 15 years ago, I would not have been able to have this conversation here with you today. Research is so important because that is where we're going to be able to find the therapies that are going to work. Biomarkers have made it so much easier to go through treatment. It's less toxic, it's usually much better tolerated than traditional chemo and radiation therapies. And knowing that you have a biomarker is just so important and life-changing.
Yeah, and can you go a little bit more in depth on what is a biomarker and why are they so important?
So each cancer is unique, and knowing what is driving that cancer is what makes us know what a biomarker is. A biomarker is a mutation that drives the cancer. So they have different ones such as EGFR, KRAS, ROS1. Brandy and I are ALK positive, and these are usually pills that you take. You know, I take a pill twice a day, and that makes it just so much easier for me to live a normal life. I'm able to run, swim, you know, hang out with my friends, lead a pretty normal life, and that is what biomarker testing and research has afforded to me. And that is why it's just so important for anyone who's diagnosed with lung cancer to ask their doctor, what is my biomarker?
Wow, that is absolutely incredible. And Brandy, you have been doing very well on targeted treatment because you found your biomarker. What's your story?
So my story is very similar to Dr. Barnett's. I'm a mom of 4. I was active. I had a small cough that I ignored because it just seemed very tiny. It didn't bother me. It wasn't a strong cough, but I would usually walk like 25 to 30 miles a week, and I would be fine during that workout. But afterward, if I were having a conversation, I'd started getting shortness of breath. So once the shortness of breath started, I decided to go to the doctor, and they initially thought it might be pneumonia. But it took a little while, but I did eventually get diagnosed with stage 3B lung cancer. I was at a local community hospital that did send my tumor off for biomarker testing. I didn't know what that meant at the time, but once I progressed to stage 4, I did qualify for targeted therapy after doing chemo and radiation.
Wow, and do you think it would have made a difference in your treatment if you had known your biomarker earlier?
I was fortunate that I did know it in the beginning, but if I were stage 4 initially, I did progress during chemo and radiation, but if I were stage 4 initially, it would have made all the difference knowing that ALK positive, which is my marker, I needed targeted therapy. Immunotherapy doesn't actually work on ALK positive patients, so it's critical for your health, really, and your treatment to know your biomarker so you can have the appropriate treatment.
Wow, this is actually pretty enlightening to me because I had no idea that, biomarker, treatment is possible. Dr. Barnett, can you be screened for lung cancer, and who should be screened?
Yes, you can be screened for lung cancer. The screening criteria right now is if you have smoked a pack of cigarettes a day for 20 or more years, if you're between the ages of 50 and 80, and if you stopped smoking less than 15 years ago, you can get a low-dose CT and you can be screened for lung cancer. I mean, of course, those screening criteria wouldn't apply to Brandy or myself. I mean, I was diagnosed at age of 33 with no smoking history. And that's why I tell patients that if you feel that there is a chance that you have a risk factor for for lung cancer, if you realize that you're having a persistent cough that's not going away, have been treated for pneumonia and still have the symptoms, you're wheezing, then speak to your provider about getting screened for lung cancer, because anyone with lungs can get lung cancer.
Wow. And Brandy, as a survivor, how important is lung cancer research to you?
Lung cancer research is critical for me. It gives me hope. Like I mentioned before, I'm a mom of 4. When I was first diagnosed, I was 39 years old. My youngest kid was only 3 years old. I had no idea if he would even remember me, because when you Google, the statistics are terrifying. But with research, we have longer survival. That's why we're able to be here and talk to you today. And it's just important because I was able to start a drug that had only been on the market for like 2 months. And that drug helped me go from not being able to breathe to being able to walk up the stairs and spend time with my kids to being a completely active mom today. And I've been no evidence of disease for the past 4 years. So research is hope for patients. Like, get your biomarker and there's hope with the research, and you can find lots of information on lcfamerica.org on the different types of lung cancer, the different biomarkers, and what treatments are available.
Absolutely incredible. Well, thank you so much for coming on today.
Thank you.
Thank you.